A very warm welcome to all of you in the anesthesia classes. The topic for today is a nightmare for many since school days. But just imagine before 1846 how dreadful the surgeries and how painful the surgeries would have been. At that time, the surgeons were not known for their precision and their patience. They were known for their speed and the strength. Believe it or not, but the minimum recorded time for above knee amputation in those times is just 35 seconds. But as you all know, human tendency is to conquer everything. And eventually, we conquered pain too. The upcoming PowerPoint presentation has a lot of images associated with it because these days picture based questions have become very popular and history of anesthesia do contribute a lot of part of it. Other than that, the important name of the scientist which you all have to remember have been highlighted, so kindly pay attention to the same. Since ancient time, a lot of herbal medications have been developed, like opium, which was used in Islamic countries, marijuana, which was famous in the Chinese people, the mandrake, Harry Potter plant, which has hallucinogenic property, quite famous in the European countries, and eventually India. In India, what was famous was hypnosis. The hypnosis of India was divided into two parts. One was Samuhini during induction, and other was Sanjeevani, that was emergence. Other than that, there were two manual methods of giving anesthesia at that time. One was carotid artery compression, because carotid artery is the main blood supply to the brain. So as carotid artery was compressed, hypoxia was created, patient went unconscious and surgery was carried out. And other most interesting method was the hammer method. Yeah, the movie method. A hammer was struck, concussion was produced, and under the influence of concussion, surgery was carried out. Now, moving forward, we had slowly and eventually many anesthetic agents that came into being. And finally, we are here today. The very first person to mention is Joseph Priestley, who is known to synthesize nitrous oxide N2O. He has synthesized a lot many other gases, for example, oxygen. The star question: who coined the term oxygen? The term oxygen was coined by Lavoisier. Joseph Priestley synthesized nitrous oxide, but the laughing gas potential of nitrous oxide was given by Humphrey Davy. And this party is known as the nitrous oxide party. This is the image which is showing the nitrous oxide party. Those days, nitrous oxide was inhaled and people used to dance and sing under the influence of nitrous oxide. So one fine day what happened was a surgeon named Colton, he invited some of his friends, one of whom was Dr. Horace Wells, to a nitrous oxide party. In that very party, one of the dancers got injured, but under the influence of nitrous oxide, he did not felt any pain. So there was the demonstration of the analgesic property of nitrous oxide. Unfortunately, Horace Wells tried to demonstrate the analgesic property of nitrous oxide in public during tooth extraction, but the patient he screamed out in pain, and thus at that time anesthesia was termed as humbug. And in the real sense, the real father of anesthesia was Dr. Horace Wells. After nitrous oxide came ether. Ether was discovered by Remundus Lucius, and the analgesic property of diethyl ether was given by Paracelsus. This is very important to note that diethyl ether's other name is sweet oil of vitriol, which was given by Valerius Cordus. Ether was being used a lot of places. For example, Clark, Crawford, they were using it in dental as well as general surgeries, but they did not popularize it. They were using it for their own self gains. Slowly and eventually, as the anesthetic agents were being developed, simultaneously the anesthetic delivery systems were also being developed. And here came the very first mask, that is Schimmelbusch mask for the delivery of anesthetic agents. Now, this slide is very, very important. Each and every word of this very slide. Dr. W.T.G. Morton, he is Dr. W.T.G. Morton. He is known as the father of modern anesthesia. Kindly note, if the question comes the father of anesthesia, it is Dr. W.T.G. Morton. If this option is not there, then the answer is Dr. Horace Wells. It was on 16th October 1846 that the first successful demonstration of anesthesia was done. The person who demonstrated anesthesia for the first time was Dr. Horace Wells, but that was not successful. The first successful demonstration was done on 16th October 1846, which eventually changed the era of anesthesia. He used ether in Massachusetts General Hospital, Boston. The surgeon who performed the surgery was John Verrin, and the patient was Gilbert Abbott. And this day is now known as the World Anesthesia Day or the World Ether Day. And this place where this demonstration took place, this is the scene of the demonstration. This can come as an image, and the question could be what this shows. This shows the first successful demonstration of anesthesia. And this place these days is known as Ether Dome. Breaking the monotony, these are some beautiful lines which were written on the tombstone of W.T.G. Morton. Before whom, in all time, surgery was agony, by whom pain in surgery was averted, since whom science has eventually control over pain. Moving forward, a quick recap. Who coined the term anesthesia? Oliver Wendell Holmes coined the term anesthesia. Again, very, very, very important question to note. Now, interestingly, when did anesthesia came into India? The first successful demonstration of ether anesthesia in India was done on 22nd March 1847 in Medical College and Hospital, Calcutta. Moving forward, ether was very pungent and very slow. So slowly and steadily, Dr. James Young Simpson introduced one other gas known as the chloroform for general anesthesia for the very first time. But he was an academician, so he did not use it practically much. It was used by Dr. John Snow. Dr. John Snow name you must have all studied in PSM also. He is known as the father of epidemiology, and he is known to use chloroform to decrease the labor pain in Queen of Victoria. Now eventually, with time, as the anesthetic agents came into being, people started realizing that the airway reflexes are being lost. So something has to be done to maintain the airway, and thus came the concept of intubations. Intubation could be oral or nasal intubations. It could be blind intubations. It could be through direct laryngoscopy, that is direct visualization. Now, the oral intubation for the very first time was done by Dr. McVan, and in pediatric diphtheric patients, it was done by Dr. Joseph O. Dwyer. The first blind nasal intubation was done by Dr. Ivan Miguel. But the thing to remember is who introduced the laryngoscope for the very first time. He is known as the father of bronchoscopy and laryngoscopy, that is Dr. Chevalier Jackson. But who gave the concept, the technique of direct laryngoscopy was Dr. Robert Reynolds Mackintosh. What he told was that the tip of laryngoscope should lie in the vallecula. Perfect. Where should this tip lie for a successful intubation to take place? Moving forward, after endotracheal intubations were considered like successful, laryngeal mask airways, also known as supraglottic airways, were developed, and they were developed by Dr. Archie Brain. Eventually came the concept of the use of anesthesia machines The concept of anesthesia machine was given by Guathmi. Please listen to what they gave. Guathmi gave concept of anesthesia machine, whereas Dr. Edmund Gaskin Boyle, Dr. Boyle is known to give the basic design of Boyle's machine. This is the Boyle's machine. He gave this design. Eventually, something had to connect the machine and the patient. That were the Mapleson circuits given by Dr. Mapleson. This is another star question from the history of anesthesia. During polio epidemic, intubations were done and ventilators were being used. The first ventilator that were being developed were negative pressure ventilators used in polio epidemics. Eventually, we had certain intravenous agents like the neuromuscular blockers. The D-tubercularine was the first neuromuscular blocker that was developed, and D-tubercularine is also the natural neuromuscular blocker which were used by the hunters to hunt the animals. It was there on the tip of their arrow. This property of D-tubercularine was used in human beings for the very first time by Dr. Harold Griffith. Bobbitt got Nobel Prize for succinylcholine. Eventually, after the neuromuscular blockers came into being, even simultaneously, the induction agents were being developed. The very first IV anesthetic agent to develop was thiopentone by Dr. John Lundy. And here I'll take 1 minute of yours. Let's have a recap. Have you ever heard the name of Dr. John Lundy? Yes, balanced anesthesia. Dr. John Lundy and Ralph Walter are known for giving the concept of balanced anesthesia. And eventually, various other IV anesthetic agents and inhalational agents were developed. Most importantly was synthesis of a very important opioid, fentanyl. It was done by Dr. Paul. And propofol was the drug which introduced the concept of daycare surgery because of its short duration of action. And eventually, with time, the latest anesthetic agent that has come into being is Sugammadex. Sugammadex is a reversal agent which is given at the time of emergence. Along with general anesthesia, even regional anesthesia was upcoming. So the first local anesthetic that was used was cocaine in ophthalmic surgeries. And who used it in those surgeries was Dr. Karl Kuhler. And who used cocaine for the first peripheral brachial plexus block? That was Dr. William Halsted. The local anesthetic which was given for the very first time as central neuraxial block was Dr. James Leonard Corning. Let's have a repetition of these three names first. Dr. Karl Kuhler introduced cocaine for the very first time in ophthalmic surgeries. Dr. William Halsted used cocaine for the brachial plexus block, and Dr. James Leonard Corning gave the local anesthetic for the first time in central neuraxial block. The first spinal anesthesia was given by Dr. August Bayer, very, very important personality in the history of anesthesia. He is also known as the father of regional anesthesia. The first epidural anesthesia was given by Kathleen and Sicard. I'll repeat these two again. The first spinal anesthesia was given by Dr. August Bayer, who is also known as the father of regional anesthesia. And the first epidural anesthesia was given by Dr. Kathleen and Sicard. A quick recap. Who gave the stages of anesthesia? Dr. Arthur Ernest Goodell. Now let's have a quick revision. Who was father of anesthesia? Dr. W.T.G. Morton. Who synthesized nitrous oxide? Joseph Priestley. When is the World Anesthesia Day celebrated? 16th October 1846. World Anesthesia Day or World Ether Day? Who introduced chloroform? Simpson. Who is known as the father of laryngoscopy? Dr. Chevalier Jackson. Who gave the first IV anesthetic? Dr. John Lundy, that is thiopentone. Who developed laryngeal airway mask? Dr. Archie Brain. The first neuromuscular blocker was introduced by Dr. Harold Griffith. Who introduced the first local anesthetic? Dr. Carl Kuhler. Who is known as the father of regional anesthesia? Dr. August Bayer. Who introduced curare as muscle relaxant? Dr. Bernard. And first anesthesia machine was designed by Dr. Boyle. That's all for the history of anesthesia sessions. We'll soon meet you up again. Thank you.